Welcome back to the channel, everyone. Our channel is about medical school, nursing school, pharmacy school, any new topics medical related. As you saw in the last video, we talked about parasomia. Did I pronounce that right?
Parosmia.
Yeah, parosmia. I can't do it. But anyways, what are we talking about today, Mitchell?
Oh, ooh, ooh. Hello, everybody. We're talking about what to study before getting into nursing school and pharmacy school. So I'm gonna touch the nursing side, and then Zach's gonna talk about what to study to get uh, before you get into pharmacy school, just to be prepared. Okay, so for everybody listening, we want to be prepared. If you're listening, is because you probably want to know uh, what to study and to be prepared. So, for nursing school, um, you're gonna need to know the basics of everything, right? Um, some nurses do end up knowing more than the doctors at some point, so you will learn more on a hands-on experience and throughout your college career. But if you want to study and you're in high school, you're a freshman, and you want to get like a little bit of time ahead of it. So you need to study cardiovascular system, cardiovascular functions, and everything that has to do with the heart. um if you study now as a freshman or senior in high school, it will cut down your studying time during college, and you will have more time to do other stuff. um I know that because I think one of my friends, I think she did this. So yes, I'm being a male nurse, you have a lot of friends that happen to be girls, but you know, what can you do, right? They're just all really cool people in the end, and that's how we always help each other. And I feel like women do help a lot more than men when it comes to studying, because some guys are just mean. Anyways, cardiovascular study. You want to do everything that has to do with respiratory, lungs, perfusion, and everything that. So how the lungs work, how the bronchioles, alveoli, and all that stuff. You want to know the basics. You can watch some. You can go into YouTube University and watch a bunch of videos and spend a whole day learning about the lungs, and it'll help a lot. You want to know a lot about renal, because we deal a lot about renal as nurses do. Um, and of course, anatomy and physiology. So the best way is you need to buy. I think I have it here somewhere. It's a flashcard deck. Um, it's called. Oh, I can't find it. That's all right. It's just a deck of flashcards that you can buy from Kaplan. I bought mine from Kaplan. And they're all anatomy and physiology. You're gonna need to know the bones. You're gonna need to know the muscles. You're gonna need to know the structures, how they work. So how the heart works. What are the steps of the heart? You know, Zach, do you know how the blood flows in the heart?
Uh, I'll get back to you in like 2 weeks.
Right atrium, right ventricle. Come on, Zach. This is like basic stuff. Oh, wow, I forgot. Before the right ventricle, you have to go through the nose, through the valve. Oh my goodness. Anyways, so anatomy and physiology, you need to study the flashcards. If you do get ahead and if you do study, you will pass with an A, like flying colors. This will be a walk in the park for you. Fluids and dimensional analysis. You do need to know that. So fluids. So what's dimensional analysis is the math um, that you're gonna need through nursing. So minutes, hours, days, because you're gonna need to know the how many days a week this medicine needs to be given to this patient. You're gonna need to know and the math related to dosage. So dosage calculations, you need to know milligrams conversion to grams and liters to fluids and all that stuff. Just need to know a lot of conversion math. Um, and fluids, because you're gonna need to know what kind of fluids you're gonna need to give a patient if it has a specific um, ailment, right? Um, so fluids and dimensional analysis. I think it's like Really, really important. Um, Acid-base balance, I don't, it's acid-base homeostasis. So what the pH, regulatory pH is um referred to as like, the body, how it keeps these fluids close to the pH. For everyone, I think I'm assuming everyone knows what pH is in here. Um, so the body can function normally. But I think treating wounds and wound treatment and everything it's gonna be really important. But I think one of the most that we deal with is this renal and respiratory. Yeah, cardiovascular is more like a specialist and we call the doctor and everything, but renal, respiratory, and fluids, you know, it's something that we deal with all the time. So I think those are the basics, anatomy and physiology. That's it. Like you're gonna have to take classes on that. So if you want to get ahead of time, study some flashcards, do some Anki, you know. What about you, Zach? What do you need?
What do you need? So I took a different approach to this and took about prereqs kinda.
Oh wow, nice.
So pharmacy, you need chemistry, OChem, biochem. So people laugh at OChem and say it's useless. It's very important.
Oh, it's really important and it's really hard too.
So let's say someone has a penicillin allergy. If you look at the structure of penicillin, they look at like a different cephalosporin. You can kind of see like which cephalosporin won't have cross reactivity just based on the structure. And so it's kind of like why this is important because you can like pick, oh, they have an allergy to this, but this is in the same class, but they have an allergy to this. Well, let's go back to OChem and biochem and look at the structure of the drug. And then you realize, oh wait, we can use this because the structure is completely different. So it's kind of how that works there. You also have biochemistry, anatomy, physiology. It's pretty much for the same reason Mitchell mentioned for nursing is that you need to know how the body works. If something wrong happens in the body, okay, that something wrong happened in the body that made your blood pressure go up. So how can we fix that? So they think about the physiology of the heart. Okay, that receptor is in charge of making the heart rate goes up, blood pressure go up. Maybe you need to put a blocker on or something, or like an ACE inhibitor, for example, like lisinopril, which is used in hypertension. So it's by knowing the physiology, which is more important for pharmacy, you can kind of figure out like how to treat it without actually looking up the guidelines. And then look at the guidelines and be like, oh, that makes sense. Acid-base balance, meh. It's important in certain disease states, but most of the time it's in check. Now, if it goes really wacky, if you really need to understand how to fix it, that's where a lot of looking up will happen is acid-base balance questions, which I completely hate. What about you, Mitchell? You hate those too?
Yeah,
They get a little
everything that is
messy.
complicated, right?
It's fine when it's working perfectly. It's really good.
Right.
Then once they go wacky, you're like, what do we do? So
It's kind of
it's
like when a code happens outside, like you're not in the room with a code, and you're like, you're fine, I'll go help. But when the code happens in your room, you're like freaking out. So
yeah, it's not good. And really just calculations too. So knowing basic
yeah,
analysis is really important. Knowing how to cross your units out, keeping track of your units, since
conversion, conversion is one of the hardest things that nurses like still don't know. I've seen like a lot of nurses who are like on the side just like doing the math in their phones. And I mean I get it, you're right. Like use the math in your phone, but like don't look how to convert, quarts to liters or something like that. You know what I mean? Like it's you should probably memorize that.
so what one of the most important conversions in pharmacy is a teaspoon to milliliters.
Oh yeah.
Do you know what it is?
I believe it's 15, right?
That's tablespoon.
Oh, okay.
It's 5 for a teaspoon,
Right, right.
which is really important because when doctors
See? You
prescribe,
see, this is
um,
horrible. I should have known that.
should have known that.
Yeah.
But when doctors prescribe like amoxicillin, they'll write their instructions in teaspoons.
Yeah.
They're like, oh, dispense 10 teaspoons or something to the kid. I'm like, okay, how many bottles is that? Do I need a big bottle? I need a little bottle? Like, what do I need?
Right.
But then if they write in milliliters, you're like, okay, I have this bottle, but how many teaspoons does
Eh,
this kid need to take? So
right,
they
but
have to convert either way.
it's not like we can put the medicine on a teaspoon and give it through mouth. You know what I mean? Like that's not how it works.
For
That's why you have to
amoxicillin,
convert.
yes, kids.
Yeah, yeah, for little kids. But like for some people, it's not like we can always convert it to like teaspoon or a tablespoon. We actually have to convert it to milliliters. So
Yes.
that's really important.
There's also some weird pharmacy calculations that include grains to like milligrams, which I'm not gonna get into that because that's never really used, only for testing purposes. But conversions they'll test you on any calculation exam. The NAPLEX is all calculation based pretty much, other than your some
Oh.
clinical stuff. But
Okay, so my nursing calculation class, I think that's remember what I in my previous video, I um I said some words that I shouldn't have. Because I got a C on it. I am horrible at calculations, but at least I do remember some of the basics. But I'm glad that you got me on that one. 5 milliliters. Oh my goodness, it's so long. I
I
don't
know,
use that. I don't use that. I usually deal between 15 and above.
yeah. So
So now, do you think it'll be cheating if it's not really cheating, but do you think it'll be cheating if, let's say that I want to get into pharmacy school and I go and talk to a pharmacy school guy and I purchase some pharmacy school books and I start reading them ahead?
is that cheating? Uh,
Not really.
well,
It's not
seeing
cheating.
how I never read any book in pharmacy school other than like one, so meh. There's like two books we read in pharmacy school,
Ugh.
and yeah, no one really uses them other than for just to read them one time and be done.
Hmm.
Not really cheating, but that's all I got for that. We'll see you guys in the next video. Peace.
So NFTs.